The charity fund in the sphere of support of social and cultural initiatives of Leila Adamyan presents Reproductive Tomorrow of Russia, Health of School Children is Our Care. Good morning, dear friends and dear colleagues. We wish you a very happy holiday on the occasion of the Day of Knowledge. I believe that knowledge is power. It's the power of occupation, power of the family, power of the profession, power of the state. And I'm very happy that we have gathered in such a big and beautiful team here. This is an educational university which demonstrates the latest achievements in science and practice, mostly in the sphere of reproductive health. Those who weren't able to come here can watch us on internet, and right in front of me there is a TV set, so I can see what we are saying, what we look like, and how great we are. Once again, I give the floor to Professor Elena Andreeva. She works in our Faculty of Reproductive Medicine. She's a professor. She's the director of the Institute of Reproductive Medicine. She was our student, and she is a brilliant scientist and lecturer. The title of the presentation is Tactics for the Management of Adolescents with Sexual Development Delay. The floor is yours for 10 minutes. Thank you, Dr. Adamyan, for such a flattering introduction. The topic of my presentation is very hard, but I'll try to be as clear as possible for all the listeners. So, everything starts in the very first minutes, hours, weeks of a baby's existence while back in the womb. Look, gonadogenital differentiation starts in the very early stage of embryo's genesis, during weeks 1 to 7, when the baby's genital organs are preparing, both in boys and in girls, XX for girls and XY for boys. In weeks 7 to 10, that is a little more than 2 months into pregnancy, differentiation happens with the appearance of ovaries and testicles. The fetus has the cells which are responsible for the reproductive potential of girls and boys, and only from week 9 to 14, the fetus develops internal and external sex organs, both in boys and in girls. So a woman may not yet know that she is pregnant, but at very early stages of the baby's development, it is already determined if there will or will not be sexual disorders, including pathologies of ovaries, suprenal capsules, etc., or such problems as having no genital glands, so-called gonadal dysgenesis, or the baby may have other sexual development disorders. Sexual development is a process of maturation of the hypothalamus-pituitary-ovary system, during which the sexual glands are developing, as well as the secondary sexual characteristics, and the sexual cells are produced. They are called gametes. The gonadal glands are ovaries and testes, depending on the sex. The process of maturation takes around 17 years. It is divided into several periods: neutral stage under 4 years of age, early and late puberty stage until 7 and 12 years of age, respectively. Afterwards, it is a puberty and juvenile stage, which finishes at around 17 years of age. During this period, it all depends on the correct development of hormonal secretion, or the hormones produced by the hypothalamus and pituitary gland. Girls have lactiferous glands growing, and later they have pubic hair growing. Then they have the first menstruation, and she becomes mature. Boys have testes growing, their penis is enlarging, then they have pubic hair growing, and the growth peak is on average at the age of 14. And if your children are lagging behind in their development according to the age, then they have a sexual development delay. In girls, it means absence of pubic hair at the age of 13 and absence of menstruation at the age of 16. In boys it means that the volume of testes is less than 4 milliliters at the age of 14. It is a serious problem which must be noted by mothers and fathers, so if something can be done on time, if it is not some big genetic problem, then it can be corrected very quickly. A child may have underdeveloped secondary sexual characteristics. As I already said, girls may have problems with menstruation, infertility, problems with sexual life, low sexual interest, or impotence in the adulthood, and later problems with getting or being pregnant. What are the root causes of the sexual development delay? As I already said, the problems start in the embryonal period. They may be genetically or peripherally caused, or happening due to the central genesis and somatic genesis, when there are consequences due to some chronic diseases, intoxications, etc. We need to determine the diagnosis, and we should remember that in 60% of boys and 30% of girls, they have a constitutional delay of the puberty period and ordinary delay of the puberty period, and we can help them and prescribe the treatment depending on the etiological factors. But in other cases, the sexual development delay may be caused by some other factors. These factors are shown on this slide. I draw your attention to congenital sexual development disorders, which will be discussed in the next lectures, such as anatomic defects, endocrine diseases, genetic anomalies, somatic illnesses, various intoxications, anemias, and sometimes iatrogenic or drug-induced problems. We must conduct thorough diagnostic assessment of the problem causing the sexual development delay and prescribe an individualized treatment. We study the patient's history, analyze all the complaints, conduct objective examination of boys and girls so as to make a preliminary diagnosis. Then we conduct some specific laboratory tests, endocrine examinations, instrumental examinations, consultations with other medical specialists, and in extreme cases, if it is necessary, we prescribe laparoscopic or surgical intervention with a biopsy of ovaries so we can see some specific genetic markers. But this is done rather seldom. But we must remember that most often the delay is caused by the family-related constitutional factors. It may happen that both the mother and the father are quite small, and both of them may be rather big. In most of such cases, the adolescent is somatically healthy. We are discussing complaints, so you can see here absence of timely menstruation, small size of testes not according to the age, shortness when compared with peers. So we built a growth curve as part of the examination. We look at the indicators of the bone system in the X-ray images of the hand palms, and then we look at the level of gonadotropic hormones, such as follicle-stimulating hormones, male and female sex hormones depending on the sex, and to determine a final diagnosis, we conduct special standard tests in order to rule out other forms of the sexual development disorder. The sexual development delay is curable. Girls are prescribed female sex hormones and boys are prescribed male sex hormones. And we can overcome this problem, or it'll disappear on its own by the age of 20, but most often we involve gynecologists or andrologists, and this problem is resolved. Sometimes the sexual development delay is associated with the peripheral system. In this case, the ovarian disorder is associated with dysgenesis, as already said, at later stages of the fetus formation during pregnancy, or when there is an autoimmune disorder of the ovaries or testicles, or if for some reason the testes or ovaries had to be removed in a surgery. Besides, there may be a loss of hormone-producing and gamete-generating functions of the sexual glands, the testes or ovaries. We analyze the patient's history, look at the level and profile of hormones, do examinations, use special genetic tests to determine the type of the gonadal dysgenesis, and prescribe the patients a gonadal-hormonal replacement therapy, replacement of the lost functions of ovaries when we prescribe estrogens, or androgens if we deal with the boys. Sometimes we do plastic surgeries, and these gonadal glands have to be removed because if a girl has testes in the area of the small pelvis, which may also happen, they may develop into a malignant process. Sexual development delay of the central genesis is called hypogonadotropic hypogonadism. It may be a disorder at the level of the hypothalamus or at the level of the pituitary gland. In case of hypothalamus, it could be a Kalman's syndrome or Bardet-Biedl syndrome, Schuller-Christian's disease. In case of the pituitary problems, it can be a congenital disorder with the development of the pituitary gland or some biochemical defects or tumors. In such cases, the patients have a typical appearance depending on the disease. We examine them and they are treated with special hormone replacement therapies, which are sex-specific. Girls are prescribed estrogen and boys are prescribed androgen recombinant gonadotropin-releasing hormones. They are prescribed vitamin D and calcium, and if necessary, a plastic operation may be prescribed. The somatogenic sexual development delay is most often associated with some chronic disease, which intoxicates the organism of the child during the puberty. It could be some hardy child labor, emotional stress, mental illness, or a nervous anorexia, which happens in girls if they drastically lose weight. All necessary examination procedures are well described. Analysis of the patient's history is very important to understand the causes of the disorders in the female reproductive system. And the treatment is going to be the same. We prescribe hormone replacement drugs and if necessary we perform a surgery or a plastic surgery. And in conclusion of my presentation, I'd like to say that the sexual maturation in the child and adolescent age determines the state of their reproductive system. The timely diagnostic and prophylaxis helps to avoid some serious problems in the future. The diseases of the reproductive system may be the consequences of not only sexual dysfunctions, but also all other systems of the body. So, if you go to the doctor on time about the problem that you may have, even if the problem is not confirmed, you will be able to preserve the health of the organism as a whole. And I'd like to remind you that everything starts during the first days of pregnancy, so the young woman must be prepared for that. And there will be a session during which we will discuss again at the University of Dr. Adamyan how to prepare for pregnancy correctly, so you don't have problems associated with the sexual development disorders during pregnancy. Thank you for your attention. See you at the next conferences of the Open University of Leila Adamyan.